So today we have a thought about the money, the safety of the brain, the fear of falling, and do we want to choose machine or device or to do exercises with the patients? The last one is that we need to think the whole body. We are our whole body and the patient is also. And this is how we are usually splitting the persons. When there's problem in cognitive functions, you go to neuropsychologist. When you have problem in your speech, you are going into speech therapy. When you have problems in the upper limb or ADL, you are going to see occupational therapist. And when you have problem in lower limbs and walking, you are going to see physiotherapist. But I would like to ask that why we are splitting the body. What is the science behind that? And is this something that comes from old generations to next generations and we don't even stop to think why we are doing this? We are just doing this because we have every time done this. And is this something what we want to continue? And there's many reasons why we are our whole body. This is only one, but after you have understood how the fascia thoracolumbalis affects the muscles, you start to think, is it good to split the patient? And here is the information about the article. You can read more from there. But if you think about the fascia needs muscles and muscles needs fascia. And from these boxes, you can see that which muscles are co-working with the fascia thoracolumbalis. And this white area and here is the TLF, fascia thoracolumbalis. And here is the muscles from the upper limb. And then we continue because these are not all the muscles. And here you can see in the yellow boxes or orange boxes are the muscles that are affecting in the upper limb and are co-working with the TLF. And all of these yellow or orange boxes, all of these muscles are co-working with the TLF and also the gluteus maximus. So, the gluteus maximus activity affects arm muscles activity. Fascia needs muscles from down and up that everything works. We need the information to go. And if you are walking without gluteus maximus activation, it is hard to get the upper limb to work. And I have seen this on my patients that when gluteus maximus starts to activate, you are getting functions in the upper arm So we really are our whole body. And Vasa concept brings together the whole multi-professional team. It is time to work together with the new knowledge. You need to bring this new knowledge to your workplace. You, OT and PT needs to talk together. If we want that the hand is working, we need to have the gluteus maximus activity. We are our whole body and we need to consider everything. And we need to work together to benefit our patients. And if the old knowledge was the one why we were splitting the body, now it's time for the new knowledge and cooperation. And now I hope that you are thinking that we are our whole body. And with that you are thinking, there's the whole body, there's the brain, and there's the gravity. And then from this yellow picture, you think about how you can expand the boundaries of center of mass. And now think a little bit about the postures that you have seen in the pictures. When you combined all this together, your Vasa concept learning journey is in a good beginning.